Hi, my name is Adrienne Welsh, and I'm going to be presenting about mental illness. What is mental illness? It is also known as mental health disorders. Refers to a wide range of mental health conditions that affect an individual's mood, thinking, and behavior. It occurs when ongoing signs and symptoms cause frequent stress and affect an individual's ability to function. It can affect anyone regardless of age, race, gender, background, etc. Promotes problems in someone's daily life, for example, school, work, and relationships. Common mental illnesses. So according to the Mental Health Association, there are over 200 classified forms of mental illness. I gave some examples below, but the one I'm going to be focusing on most in this presentation is depression. So there's mood disorders, which consists of depression and bipolar disorder, anxiety disorders, schizophrenia, eating disorders, personality disorders, which include antisocial, obsessive compulsive, which is also known as OCD, substance abuse and addiction, and sleep-wake disorders. Causes of mental illnesses. Conditions are caused by a combination of inherited traits, psychological, and environmental factors. Inherited traits. They are common in individuals with blood relatives diagnosed with mental illness, and their specific genes may increase the risk of inheriting a mental illness. Psychological. If there was severe psychological trauma suffered as a child, for example, early loss, and then neglect. With environmental, life situations that put the body under stress, which is also known as stressors. For example, death in the family, financial burden, divorce, school, illness, etc. Signs and symptoms. So there are many signs and symptoms, but I listed some below. So if an individual is feeling sad or down, they are unable to concentrate, they have excessive fears or worries, they are withdrawn from friends and family, have low energy or problem sleeping, suicidal thinking, and major changes in eating habits. I also included a little chart called Know the 5 Signs, and it's just little faces with signs below. For example, personality change, agitated, withdrawn, poor self-care, and hopeless. Those are one of the, they're the most 5 common signs. So signs and symptoms continued. If someone has unusual behavior, increased sensitivity, appetite changes, and illogical thinking. Some symptoms may appear as physical problems, for example, stomach pain, back pain, and unexplained aches and pains. So here is a simple mental health pain scale. It rates mental health from mild to severe. It goes from 1 to 10, mild being 1 through 3. Everything is okay, there's absolutely nothing wrong, and you're probably cuddling a fluffy kitten right now. And then we move on to moderate, which is 4 through 6. So today's a bad day, or you're having a few bad days. You still have the skills to get through it, but be gentle with yourself, and you should use self-care strategies. And then we move to severe, which is 7 through 10, which is the worst mental and emotional distress possible. You can no longer care for yourself, and you can't imagine things getting any worse. This is when you should contact a crisis line immediately. So we rate them from 1 to 10, 1 being mild, 4 being moderate, and 10 being severe when you should contact a crisis line. Diagnosing mental illness. So we have the medical history, and then we go to the physical exam, which is when the doctor can try to eliminate physical problems that could cause mental illness symptoms. There's also lab tests, which mainly test for thyroid function, and there's also screening for alcohol and drugs. And then there's a psychological evaluation. This is an evaluation of symptoms, thoughts, feelings, and behavior patterns. It will basically answer questions about your thinking, feelings, and behaviors. And then there's neuroimaging scans, which is the more recent way to detect and diagnose mental disorders and illnesses. So the Diagnostic and Statistical Manual of Mental Disorder, also known as DSM, which is the purple book, I found the 5th edition. This is a standard manual used for evaluation by professionals, and it was assembled by the American Psychiatric Association. Medications. Treatment depends on the type of mental illness the individual has, its severity, and what works best for them. This usually involves some form or combination of therapy and medication. Since I'm going to be focusing on depression in this presentation, the common medications for depression are antidepressants, and one of the most common ones is Lexapro. So, effective antidepressants on exercise. Lexapro. It can cause weight gain and make exercise more difficult, can cause drowsiness, dry mouth, and excessive sweating. However, to avoid these problems during exercise, you should take medications after exercising. So, for example, if you exercise in the morning, you should take your Lexapro at night before you go to bed. Management. The first is psychotherapy, which is known as talk therapy. This is talking about your condition in a one-on-one or group session. And then we move to the brain stimulation, which is commonly used for depression if psychotherapy doesn't work. And then we move to the hospital and residential treatment programs. This is when an individual cannot care for themselves or may harm themselves. Can be 24-hour inpatient care, day hospitalization, or residential treatment. And then there's home remedies. This is when an individual can do things for themselves to help with the treatment plan. This includes staying active, avoiding alcohol, and just overall having a positive attitude. Effects of mental illness on the exercise response. So exercise releases feel-good endorphins, and endorphins increase natural immunity and reduce feeling of pain. The individual will also gain confidence, have more energy, better sleep, and sharper memory and thinking. And the little poster I have to my it's on my right of my screen says 20 to 30 minutes most days a week will enhance the action of endorphins. And then it says boost strength to boost your mood. So this is a study I found. It lasted 10 months, and it compares the long-term impact of exercise versus medication on depression. So if you see the dark black bar, those were the patients that recovered completely. So with exercise, about 85% recover completely. With medication, about 55% recover completely. And then a combination of both exercise and medicine, there was about, I would say, a 65% recovered. So overall, exercise had the most percent recovered. Now we're going to move on to my case study. My patient is a 28-year-old female. Her BMI is 19. She's a smoker, which is a positive risk factor. She's sedentary, which is a positive risk factor. Her resting blood pressure is 130/74. She has no history of CVD or CAD, no family history of CVD or CAD. She is on medication, Lexapro, which is the antidepressant we discussed earlier, and she does have a medical history because she had one episode of feeling suicidal. She is asymptomatic, but has 2 positive risk factors. Therefore, she is at moderate risk level. She is constantly stressed due to her demanding job as a physical therapist in a local hospital. She has high standards for herself and is very self-critical. Recently, she has been feeling worthless and tired. She also noticed she is having trouble concentrating at work. So therefore, her primary doctor diagnosed her with major depression disorder, which is also known as MDD. However, she does not have the financial resources for regular psychotherapy and therefore sees this as an opportunity to try exercise. Her goals. Since she is healthy and satisfied with her weight, she wants to focus on improving her mental health and to feel better about herself. She also wants to eventually stop taking Lexapro if exercise produces better results. Exercise testing. It is important to note that the symptoms of depression might affect performance during exercise testing. I chose the Modified Bruce Protocol Test. This is a maximum exercise test where she will work until exhaustion, increasing the treadmill speed and incline every 3 minutes. However, she should be monitored to see if she experiences any of the side effects of Lexapro, and the patient needed motivation to finish the test. However, we will focus on aerobic and strength training. Exercise prescription. Symptoms must be stable and cleared by a physician before starting. Aerobics, which included running, walking, swimming, and biking. 30 to 45 minutes daily, which she can break into segments because of her busy work schedule. 3 to 5 days per week. 60 to 70% of heart rate reserve. However, she should begin with low intensity and work up to moderate intensity. Exercise prescription continued. With resistance, she's going to do machines and free weights. There should be 10 to 15 reps per set with 1 minute rest in between each set. And her RPE should not exceed 15. And then she's going to do this 2 to 3 days per week, incorporate it within her aerobic exercises. So this quote is from Brett Gordon. He examined the effects of resistance exercise training on symptoms of depression, and I found it extremely interesting. So he said, they found that strength training was associated with improvements in depressive symptoms such as low mood, a loss of interest in activities, and feelings of worthlessness, regardless of a person's age, sex, health status, specific exercise routine, or improvements in physical strength. So here are some strategies when working with a patient that has depression. You should give the client positive feedback, discuss about the positive benefits of exercise, create ways to make exercising enjoyable, talk to family members and have them encourage the client as well, and support system is just as important. So some modifications. Since the symptoms of depression might affect the exercise program, modifications must be made. So first, start small. This avoids frustration and self-blame when an individual doesn't meet their high expectations right away. Keep track of all the exercises, which allows the individual to trust themselves to do the exercises again. And patience. Since depression takes time to heal, it is similar to seeing the results during exercise. And conclusion. Exercise is good for mental health. Regular exercise can help manage depression symptoms while boosting an individual's mood. And the benefits of exercise may be comparable or even better than those of therapy. Overall, be encouraging and motivating. And here are my references that I used for this presentation. Thank you.